Well, there is no end to the number of products on the market to combat aging, but medical professionals seem to be using something called fillers more and more. So what are they and what can they do for you? Here to answer our questions from FUZION Medical Aesthetic Boutique, Associate Medical Director and Physician Assistant Kati Midgley. Thank you so much for being here, Kati. We appreciate it.
Thank you for having me, Sonia.
We're talking about fillers today. When we talk about fillers, we're not necessarily talking about filling in the wrinkles. What are some of the benefits of these fillers?
Well, as we get further away from the age of 25, we start to notice more fine lines, more wrinkles, more loss of volume. And the most technologically advanced way that we have to do that without surgery is to use dermal fillers. Dermal fillers are various products. There are about 9 or 10 on the market that we use for restoration of the volume to help bring back the detail that you had when you were younger, or to also just re-volumize the face, just that rejuvenated look.
What exactly is it, though? What's a dermal filler?
Dermal fillers are made of different products, mostly hyaluronic acid, which is found in your body, and substances that are also biostimulators, which cause your own collagen to grow. So depending on which one you're talking about, you're looking at a little bit different product. Most are hypoallergenic, though. People are slightly nervous about allergies. The products that we use at FUZION are hypoallergenic, and if we do branch out into something a little bit more worrisome, we will do allergy testing prior to.
Okay, that's important to point out. We do have some examples, though, to kind of take us through the process and show the progress as it goes on. This is the first example. This is the before shot, and then I believe we have a shot as she's kind of going through the process. Tell us here what she had done.
This is the perfect shot to see. I like to take this photo as patients come into my office, is that the left side of her face has already been completely restored. You want to look at the mid-face, where the cheek is fallen sort of forward and creating that line that we call the parentheses, and then further down where she has this, what everyone comes to me and says, these jowls. So on the left-hand side of the face, you can see that the restoration has already been taking place and the results are immediate. The right-hand side of her face, unfortunately, still has a fair amount of cheek prominence.
Yeah, there is a difference there.
And jowl formation. And I think the last photo you'll see is her with full face, very small amount of mineral makeup. It's untouched photography, but you'll see that from the first to the last, there's a very large difference. This woman went out right afterwards shopping with her friends, and they couldn't pinpoint it. They just thought she looked like she had been to, on vacation. So
it is a pretty big difference. And this isn't a long period of treatments, though, right? Are the results pretty immediate?
Depending on which filler you get, it's either an immediate treatment, one-time filler. Mm-hmm. You come into my office, we talk about what you want, we fully assess your face, you get a consultation, I listen to what you want. It's not just what I perceive. We have a conversation about what you're looking for, and then it's a one-time deal.
Why would someone want to choose a dermal filler over another procedure? What are some of the benefits?
The biggest question I get is, what's the difference between Botox and fillers?
Yeah.
There's a lack of education here. There's not a lack of advertising for these products. There's a lack of education. But if you think about it very simply put, that if this is your skin, this is the fat and fascia layer, this is the muscular layer, and this is the bony layer, Botox is different, where we stop the wrinkle from happening. We stop the contraction. They're serial injections that just go right to the muscle and down. Botox takes 3 to 7 days to kick in.
Okay.
Fillers, on the other hand, are immediate, and depending on which filler you're talking about, it goes right under the skin. Other fillers go a little bit further down, but we're volumizing from below. We're not entering that muscular layer. We're actually filling the soft tissue of the face.
It's a different placement. Now we have another before and after of someone who got this done in a more traditional area of the face.
Right. This is a younger patient. Not all of my patients are 50, 60, 70, although a fair number of them are. What we've learned over time and through science is that these procedures are preventative as well. This woman had her traditional, she didn't have mid-face filler done, she actually had the traditional nasolabial folds. She also had a little bit of restoration of her upper lip. She had some asymmetry. The right side didn't match the left side. We also did some Botox on her, but it makes her face, your eye is drawn upwards towards her eye.
It lifts everything up.
Exactly.
Now pain-wise, what are we talking about in terms of pain?
There are various, I have some people that come into my office and say, I don't need anything. I don't like to do that because I think it's a it's something that does need to be addressed, but we have 3 different ways of addressing pain. I have a topical anesthetic that we use. We're very well versed in doing dental blocks, as if you were to go to the dentist, so you're numb from here to here. And then the last way that we use anesthetic is I actually mix anesthetic into the product that we're injecting into your face, so as you're going, it becomes even less painful.
Okay, and I guess it's based on someone's own tolerance.
We talk about that beforehand.
Right. How long do the effects last?
Depending on the product, the FDA will give each product a certain amount of time. Now, in reality, the FDA will say it'll last a year. I will tell you, in being very honest, is that depends on where you put it. If you put it in certain areas that won't last so long, it can last 9, 10 months. Other products last well beyond that.
So, okay, we have one more before and after that we want to show you. This is Debbie before, and I believe we have another before shot of Debbie as well from a different angle. And what did Debbie have done? We actually have Debbie here with us today. What did she have done?
Debbie actually is the winner of our Fusion Grand Opening 10 Years Younger contest. And Debbie has received...
And here she is. Let's take a shot at Debbie. You look fabulous, by the way.
She does.
You look great.
Debbie's very nervous. Debbie has received Botox in her forehead, around her eyes. We did some mid-face fillers in and around her cheek here. We did a lip augmentation, which is one of the most popular procedures. We did a pre-jowl filling of her lower face, and we did a chemical peel and a microdermabrasion and teeth whitening. So,
how do you feel? I gotta know.
I feel really good.
What do you feel like this treatment's done for you and the response that you've gotten from people?
The response I got is subtle. They really can't figure out what I did, but they know something's different.
They know you look different and you look great. They just can't put their finger on it. Well, they might know now, actually, after this. But you do look amazing. Thank you so much for coming in.
Thank you.
Katie, I want to ask you, though, is this a pricey procedure? This is something that in the past we might have thought was just for, you know, the wealthier, not just for the rich and famous, right?
No, not anymore.
There goes Debbie.
Bye, Deb.
Yeah.
Not for the rich and famous anymore. My average client probably makes about $50,000 a year. This is something that is not just for movie stars. It is something that when you start to look in the mirror, if you notice an issue, that's when you make the call. Don't let it go too long, because then we have to use more product and it takes a lot longer to actually fix the issue.
All right, well listen, if you want more information on dermal fillers or any other cosmetic procedure, you can contact Fusion directly or just come to our website, WTNH.com, click on the Connecticut Style link, and we'll get their link for you. Thank you for coming in, Kati Midgley, and of course Debbie for coming in as well from Fusion Medical Aesthetic Boutique.
Thank you,
Appreciate
Sonia.
it.